I'm really excited about this panel because we have so many people with so much experience in the space. So I'm really looking forward to talking about what the funding landscape looks like, particularly for a field that historically has been left out of a lot of program and project funding, and that now perhaps one of the few silver linings of the pandemic has been that it actually has come to the forefront in a much bigger way. So even though we know that investment is low, both from government and also from private sector, we also think that there are a lot of funders that are starting to get this. So I want to know if there's, I want to start by asking you guys my first question. And obviously I ask that you answer really hard questions briefly, because this is what panels are about, right? But I want to get a sense from you whether you think that there's an area within mental health specifically that's been, or even just social impact in general, that's gotten more attention now, right? In the recent, in the last couple of years, or even expanding it a little more. I'm curious if you guys could speak to that. And I'm looking on the screen, so maybe I'll start with you, Caroline. You're in my top left, so if you could.
Sure. Hi, everybody. Thank you, Selena, for this wonderful conference. It's been such an interesting day so far. I'm Caroline Cronley. I'm the president of the Tinker Foundation, which focuses on supporting civil society organizations in Latin America. And for us at Tinker, as a funder that focuses deeply on education, I think as we heard the opening panelists talk about, right, the impact of the pandemic on children and families has been so particularly strong. And for us as funders who think a lot about education and getting, children and adolescents back into school, successfully learning again, we really can't think about that without also being attentive to the mental health of both students and, frankly, teachers. And so I'm happy to talk a lot more about that. But for us, that's really been the entry point to thinking about mental health more in our own grant making, and with a lot of learning from Glasswing along the way.
Thanks, Caroline, and thank you for introducing yourself. I think that would actually be awesome if you could each just give that one sentence to tell us about you, although we can also look up your bios. Craig, what about you, coming from J&J? What's your perspective in this space, and what it's been looking like, or how it's been shifting more recently?
Yeah, thanks, Selena. Craig Kramer, I'm the mental health ambassador for Johnson & Johnson, which is a relatively recent role that we created to find ways for our organization to contribute to transforming mental health care worldwide. I think this has been a neglected area because there's sort of a vicious cycle of the stigma that makes people reluctant to get care, the access barriers in the system make it hard to find care even when you want it, and then the lack of real investment and advances in science in this area, that even when you can get care, it's often not evidence-based or outcome-based. So this vicious cycle of stigma, system, and science have been frustrating for everybody, including employers. And I think COVID has, even before COVID, I think there was a rising awareness about how this was impacting our workforce. The World Bank did a study in 2016 that showed that every dollar that an organization invests in their employee mental health results in $4 to $5 of return on the investment. And then COVID has shined a light on the fact that all of us have mental health. It's not about necessarily having mental illness, but it's about having the ability to thrive, and so I think employers of all stripes, not just private companies like ours, but governments and nonprofits, are starting to take a new look at this, which is great.
That is great. And I think that's a really valid point, right? That it's mental health, it's well-being, as opposed to always kind of switching it in the other direction. Carla, what about you? What are you seeing in this space?
Sure. So hello, I'm Carla Thompson-Payton. I'm Vice President for Program Strategy at the W.K. Kellogg Foundation, and we fund both domestically and internationally. And I would say that when you think about the Kellogg portfolio, most folks wouldn't say Kellogg funds in mental health. But what we do fund is health and well-being, social emotional support, and we think about the ways in which trauma has impacted the communities that we most care about. And when we hold children at the center, we try to think about what are the ecosystems that need to be in a good, healthy space in order for those children to thrive and succeed. And so we know children are centered within families and families are centered within communities. And in order for communities to thrive, you need strong school systems where children are being seen for who they are and celebrated. You need families who have livable wage jobs, who can function executively within those jobs and have a career ladder. And then when you're thinking about the whole health of the community, how are they accessing health and mental health? Particularly because we have a racial equity bent within our work, we're always thinking about the trauma that racism, colonialism has impacted the communities that we serve, and ways in which we can highlight the negative impact so that we can address and heal from those unfortunate events. And so for us, it's always thinking about, what is that ecosystem? How is it interwoven into everything that we're doing? How are we helping communities give voice to the things that are holding them back from success?
Yeah, and it's so interesting, as right before you started going into equity, I was going to ask that, going into, the Elizabeth's comment too, because we talked a lot, Elizabeth, about equity. So I'd love to hear your perspective and just the kind of what's coming through from all three of you is this kind of ecosystem, this broader approach to mental health, which I think is going to be important as we have this session on the funding landscape and what the implications are. So Elizabeth, I'd love to hear from you also, from your perspective, what you're seeing.
Yeah, thank you, Selena. And it is such a pleasure to be here today. Thank you for bringing us all together. I'm Elizabeth Binder. I am a partner at the Bridgeband Group. We are an organization that supports, we're a nonprofit that supports other nonprofits as they seek to achieve their goals. We work with nonprofits and funders. And so, in my work, I'm able to kind of have the privilege of working with both of those lenses. Very passionate about mental health. My focus is on early childhood, increasingly on mental health. And of course, there are so many parallels in those fields. I'd say one thing that we are observing is that there is a change in the landscape in terms of the way funders are thinking about the space. In talking with some of my colleagues, we've never seen such interest in the mental health space as we have recently. Now, I don't have stats on how that translates to changes in funding flows yet, but I will say the level of engagement and interest is different than it has been, even kind of increasing by almost by the month. That may be too much, but really increasing. A couple of reasons for that, I'd say. In the past, perhaps mental health, in addition to some of the themes you've all mentioned about the stigma, may have been a bit more invisible and seemed less urgent. And the pandemic, amongst other factors, has made it more visible and seem more urgent. And Selena, to your question, also to pick up on Dr. Payton's themes, I would say that we are all seeing a different focus on equity within mental health and sort of the recognition that populations that most need access often face the highest barriers to access to care. And then on top of that, there's a need for programming to be relevant, right, to groups. So I think we're seeing that those kinds of themes in our work, and happy to pick back up on more, but I will pause for that for now.
Yeah, I mean, I think, in the plenary and probably in a lot of the sessions, there was a lot of conversation about localization and how you really, and I think that's coming up already with you, all of you on the panel, and it's, how do we make this more accessible now, especially how do we ride this, right? Like when you talk about when something gets momentum, because perhaps if you were investing in education or children or development before, both on the programming side and also in J&J's, right, as a pharmaceutical company, also like thinking about where to work in these spaces, but I think, and the populations we work with. But I'm curious, how, now that it's becoming more explicit, sometimes it's tough still because it's a newer space in philanthropy, how, and both corporate and foundations, how can we as organizations and even government, right, the people here who are here from government, how do we start to make it more explicit? Like, how do we make it a priority amongst funders that perhaps aren't thinking about mental health as part of an ecosystem and aren't thinking about it as something that is necessarily linked to other outcomes? Because I think we see it very obviously when you work in the space, but it's not necessarily the case. Like, I know I've spoken to people about mental health and their eyes glaze over, right? And they just think about clinical. So I'm curious, and maybe I'll kind of do the reverse order, and I'll start, Elizabeth, with you. Like, what can how, as we think about the funder landscape, how can we elevate it even more? Not as like, this is like a siloed thing we need to work on, but, perhaps how do we make it more relatable, I guess, is the question.
Yeah, so I could go in a few different directions with that, but I think, I'd say there's increasing recognition of how fundamental mental health is in its own right in terms of better outcomes for people and the connections between mental health and outcomes in other spaces. And so where I would go with that is to like really explicitly draw those connections between mental health and improved mental health and outcomes in other spaces. And that can be through, if you as an organization are running a program, it could be through your own data, or it could be through, the studies that link better mental health outcomes, for example, to better outcomes in the early ed space, to better educational attainment, to other factors like that. So I'd say it's one place to start would be to explicitly draw those connections between how foundational mental health is to outcomes in other spaces. Second is how foundational mental health is to the people delivering those services, to the frontline folks who simply cannot carry on, right? Many of them are, despite maybe not being able to, and how foundational that is to being able to really accomplish almost anything in the social sector right now. I'm curious to hear what the others on this panel will say, but those are two things I'd highlight.
Carla, what do you think?
Sure. So when I think about this, I think language and definition is really important. And I think for some of the communities, particularly the communities that I work in, the mental health system hasn't always been kind, and it hasn't always felt as a partnering system of support. And so what we've been trying to do is really help folks identify what is it that they're seeking that's prohibiting them from reaching the goals that they set for themselves and their families and their communities. And then helping to understand the language that they use to talk about the things that in a clinical fashion will say, oh, this is mental health, this is a diagnosis, this is a support structure. But for them, this is, I'm really worried about my child not being in a safe environment, and what's that's causing them to act out. What can I do to support my kid in school so that they can stay focused and they can, do the things that I need them to do in order to learn and progress? What does that mean for the mother who's pregnant and is going to a health system that doesn't necessarily understand the trauma that she's experienced by being poor, being pregnant, and not really trusting the medical system? How does that impact how she accesses services when they're needed, but doesn't feel comfortable or trust the systems in which she can access? And I think when we talk about language, when we talk about definition, we begin to unpack what is it that people really need in order to be supportive. And I think that was the shift for us at the foundation when we started listening to the stories, trying to understand from their perspective of what they were seeking and why. And then it became less of, it's a formalized approach all the time, to more it's, what can we do to support you in what you need to do to heal, grow, and progress? And that's what got folks within the foundation really comfortable about thinking about the impacts of trauma, thinking about the impacts of poverty, thinking about the impacts of racism and how it shows up in the systems in which we work.
Yeah, and I think, and what you're saying, right, I think it's, the semantics is important and the language is important, because if you don't have the language and you can't bring that forward when you're engaging with systems, and even if you do and the system doesn't have the services, that becomes really important. So, I think, we have to find ways to kind of amplify the narrative around how mental health is really a part of these other things that we're working on. It's not,
and demystify it and show that it's vast, and there's different spectrums within it.
Right. Which actually is a good segue into you, Craig, right? Like how, from J&J, and obviously there's the clinical, there's the non-clinical, but what do you think? And as a corporation, and a corporation that does, have strong philanthropic arm that's been doing work for a long time on different health issues, what do you think about this? Like, how are you seeing this space?
I'd like to echo the observations that this is very intersectional, both in terms of populations, but also in terms of issues. The number one impact of any natural disaster is the long-term impact is mental health, it's suicides and family breakups and loss and anxiety. And then, the frontline workers, whether it's essential workers, especially the health workers during COVID, and then our different health equity challenges that have been shined the light on here. So I think all those things are important, and I like your talking about people. What do they need? How are they addressing this issue, right? And I think that I also want to just mention that there's another side to the traumas we've been through, and that is the observation that most people experience what's called post-traumatic growth after a trauma. And we've seen this whether it's in combat or natural disasters or human interactions, abuse, trauma in the household. And so in addition to treating the pathological, let's call it that from a medical standpoint, repercussions of these events, we also want to create an environment where we're enhancing the opportunity for this growth. What are the protective factors? What are the growth factors? So it's not always a story of a negative trajectory, but how can we get more people on the positive trajectory that is actually how our brains are wired to respond to challenges.
Thank you, Craig. No, that's part. I think that's a really important point to make when we think about the narrative. So it is more kind of it's looking more at the strengths perspective, and it is more child-centered, youth-centered, adults. It's human-centered to approach it that way. I think that's a really good point because I tend to hear a lot in the spaces where I work, a lot of mention about PTSD, and particularly in settings where they're not necessarily as informed. It just kind of is a term that's become very widely used, perhaps to a fault, right? That it kind of can be a detriment. Thank you, Craig. Caroline, what do you think about I think what I was asking earlier, and then also what the other panelists are commenting about?
Yeah, I mean, I appreciate so much that in this conversation, as funders, we're not just centering the kind of importance of working on this issue, but also of supporting the mental health and well-being of the people who are doing the frontline work, as Elizabeth described. And this is super present for me because I was just last week visiting a number of our grantee partners in one of the countries where we work, and multiple people unprompted told me that they're in therapy to deal with their kind of anger and sort of distraughtness, right, over the situation they're facing. And so I think it's really incumbent on us as funders to sit with our partners and ask them, like, what do you need to do this work with energy and with hope and with joy over the long term, right? And then listen when they tell us. And I think some of it might be about sort of formal supports and access to services and so forth. And some of it might just be about spaces to come together as peers and talk about what they're facing and feel heard. But I think increasingly that's just part of the work, perhaps, of being a responsible funder working on really challenging issues that can wear people down.
I mean, and that's music, right? I think it's music to my ears, and I'm sure there are a lot of people who are listening. I don't think we often think to bring that up with our funders. Like, we don't think let's bring up the fact that our teams or our counterparts in government, or you don't want to bring up weakness to funders. And I think that's important that you brought that up right now, because all of you are funders, and you're funders from really, funders, or, in the case of Elizabeth, I know that you're NGO, but you're kind of you cross both. And I think that's a really important point to make, that we need to also, on our end, in terms of the funding landscape, be more honest about bringing these things up. And I think if we think about funders as human beings on the other end, as opposed to just kind of like this institution that's going to evaluate and audit, and it probably becomes an easier conversation when you're like, we can't move forward if we don't address that. And so I appreciate you bringing that forward, because I think that is a challenge for all of us, and we don't do it enough. I think, one other thing I wanted to ask you is, what in the work you've been doing, what have you seen from the funding standpoint that you do find interesting, whether they're innovations, like what, we talked about, I think all of you mentioned strategies that are important in garnering more support around mental health, and the way we link it to other outcomes, the way we understand it as part of an ecosystem, how we can bring it forward as something that is necessary for child-centered or youth-centered programming, community-centered programming. But what specifically, or what have you seen that your foundations or other foundations have supported that is interesting in this space. You know, we heard earlier from Child Mind Institute, there's interesting clinical approaches, there's interesting community approaches, and I'd love to hear, and it doesn't have to be like any specific organization, but just strategies that you've seen that you find interesting, that you think could be applicable in multiple contexts too, because we don't have to make this up, right? There are things that are being done and are working. So I'd love to hear, and maybe, Carolyn, if we could start with you, I'd love to hear what you've seen as a funder that you do find interesting in the application, so to speak, or in the amplification of access, or in the integration of mental health in programming. So I think that would be good for us to hear a little bit more about too.
Sure. So I feel really inspired and excited by models that are about meeting people where they are. And, again, supporting the people who are sometimes most proximate to those who have trauma or are facing mental health challenges. So, to invoke the Glasswing model in some ways, that the work that you all have done to experiment with different approaches to supporting teachers to make their classrooms to be safe spaces where students can sort of recognize what they're bringing into the classroom, but also address it and then be able to learn and feel safe in the classroom, I think is incredibly powerful. And we've seen from your very rigorous data collection, right, the spillover effects that has, not just for students, but for teachers themselves and their well-being, and also broader school communities. So I think those kinds of approaches are really interesting to watch, again, and not just classrooms, whether it's in healthcare settings or even in policing settings, right? Thinking about how we empower and support people closest to the challenges to respond effectively. And then, of course, also, link to more professionalized clinical resources where that's really important or necessary too.
Yeah, and what we've tried at Glasswing is almost always something that we've seen somewhere else, like pretty much 90 to 100%, it's an adaptation of, learning, whether it's from, calm classrooms, or we look at calm corners and what a community schools model looks like internationally. So it is I appreciate you mentioning Glasswing, and I just want to underscore that a lot of what we do is really an adaptation of things we've learned from peers in different parts of the world, and try to learn from them, reach out to them, learn from them, and adapt. And so, and also just asking, like what makes sense for kids, asking kids, they'll know better than we will, children and young people and families. And what about you, Craig? What are you seeing in the mental health space globally that you find really interesting or exciting from your perspective?
Well, as a healthcare company, we're focusing really on the frontline health workers in this post-COVID environment, and helping them with their resilience, their post-traumatic growth, but also a lot of the post-traumatic stress. And we're looking also at new funding models. This is an area that is ripe for social impact investing, because there's so much need and so much opportunity that there are ways to get returns on your investment. For example, not one that we're involved with, but up in Massachusetts in the United States, in many countries, the largest mental health facilities are jails, and that's true in my country, the United States, because we don't have operating mental health systems. But if you invest in trying to keep people out of prisons and get them to the care they need, you can see a reduction in law enforcement costs, and also an improvement in your productivity and tax base. So we're looking at kind of new ways to think about funding and getting returns for everybody, all stakeholders on mental health. I'm sure others will talk about some of the exciting things. There's a lot of telehealth really took off alongside of Zoom now. So providers can be present with thousands of digital apps, and how you sort through those is another challenge. I think one thing that I'm excited about is peer support. So having community health workers or even non-health workers who could be trained to lead peer support groups and fill that gap of providers and lower the cost of care. Those are some of the things we think I think are important.
Thank you. Yeah, and I think that is really interesting. I think thinking about ways, and even though we had, earlier there's a social entrepreneurship panel, and just also ways to think about this in a way that also makes it sustainable, right? Like what models exist where we can simultaneously provide access to mental health care and also generate some sort of income to be able to sustain that. I've been seeing a lot of that too, and looking at what people are doing. It's really interesting. And you mentioned the peer groups, and I think that all of us, when we think about mental health, really, there are so many ways to address adversity, and now we're calling it mental health. Someone else might call it something else, right? We had one of our panelists, Paul, talk about this in the plenary, that even if we haven't been calling it, and we go back to language and semantics, like Carla said, we haven't been calling it trauma or mental health. There have been healing strategies, community healing strategies, and indigenous communities, all kinds of communities, that it's almost like we tend to forget about, and everything seems to have to like come something new. But at the end of the day, healing is a lot about relationships, right? And resilience is a lot about relationships. So it's you brought up the peer support at the end, and that's such a low cost, right, in terms of resources way to not just foster better relationships, but also when you're in a moment of a lot of stress or sadness, it's a resource that's much more proximate to where you are and more accessible. So, and it also builds all kinds of just heals social fabric and has all these other outcomes as well. So I'm glad you brought up the peer support also. Carla, what about you? What are you seeing that you find really interesting in the different parts of the world that you're working in, and also in the US? I'm curious.
Yeah, for us, it's really around that community-led engagement and seeing communities come together to solution around how they want to address whatever they're experiencing, both it be positive or a struggle. And for us, looking at community leaders, both formal and informal, who are able to sustain the work or the initiative or the effort long past the finite funding we're able to supply is really important. So the projects that we tend to fund, we tend to get really excited about, are community-led. There's all levels of leadership. It's based on practices that community has long held as true. So it doesn't have to be in the formalized system. As you mentioned, indigenous practices, going back to traditional practices, going back to seeing people as human beings and that human connection, and then feeling that they have localized support to help them on the good days and the bad days. And one of the initiatives that we've been funding for a number of years that we've seen really take off during the pandemic and during some of the geopolitical things that we see across the countries that we work in is our healing circles. People coming together to share their experiences, talk about the resiliency that they've had to express, support each other through the good times. And those healing circles and the demand for funding for healing circles have been tremendous. We've also seen an increase in demand of just capacity building and leadership support in the grantees that we're supporting. We need general operating funding so that we're not thinking about chasing after dollars to support our work. We need to give respite to our staff. We need to have some opportunities for us to come together and find our voice. And so those are the things, particularly in the last 2 years, that we've been funding at a much higher rate, recognizing that all of us are human beings. All of us are experiencing the chaos of the world. All of us want better tomorrows. And so therefore, how can we work together to achieve that?
That's really exciting to hear. And I think it's exciting to hear that healing circles are expanding from what you're seeing, because it does draw on so many strengths, and that you're funding that. I mean, I think it's, and aside from what we talked about and that you mentioned right now about funding organizations to deal internally with the adversity the teams are facing, the healing circles are, again, thousands of years old, right? So that's something that we don't need to come up with, because sometimes a lot of the interventions that, we all understand the value of science and evaluation, but sometimes that's also really costly for organizations, and it's not easy to evaluate every program or to have, these universities or institutions. So drawing from something like healing circles, and if we all understand that these are practices that already pre-existed, the science of mental health was pre-existed just by healing and by how people coped with adversity. I think is also really important, really important to underscore in this conversation. Thanks, Carla. Elizabeth, what do you think? What's your perspective on this?
Well, first, it is exciting to hear about these innovations. So I'm happy to be here and hearing them. Can you all hear me okay?
Yeah, perfectly.
Okay. I'd say one thing that I would add that you all have touched on in different ways is this idea of kind of supporting and training community members, professionals in other fields to be able to provide mental health supports. One of my colleagues calls it increasing the supply without increasing the supply. And, and when she says that, in the US and I know in many other countries in the world, there aren't nowhere near enough specially trained mental health professionals. And yet there's such exciting and inspiring work going on by so many organizations that are finding different ways to train teachers to run cognitive behavioral therapy groups, to train, talking about your work, Selena, to train different frontline workers, to train community members, to train, there are just, I think, a lot of really exciting innovations and interest in that kind of work.
That's good to hear. And I was about to ask you, what are you not seeing that you'd like to, but we actually have questions from the audience, so I want to respect it. One of them that came up is, do you see the need for funders to become more trauma-informed in order to be clear about the need for supporting mental health and services for people in the organizations themselves? So how can we make it, or even how can we as practitioners, or maybe how can you as different kinds of funders, how can we change the narrative in terms of across the funding landscape around the need, specifically in this case, they're asking specifically the need for people within the organizations themselves. I don't know if someone wants to take a crack at it.
I mean, I'll just say really briefly, since I mentioned this, that I do think this is something that has to be broached with enormous self-awareness by funders, right? So it's really not constructive for funders to sort of lean into this in a really extractive way and ask grantees to talk about, their trauma, right? That's not a good way to approach this. I think it's much more a process of trust and relationship building and inviting input on how we as funders can be more effective in supporting organizations. I think that needs to be the entry point. And so I'll just leave it there as a kind of addendum to my previous comment.
Thank you for that, though. I think it's important. Anybody else?
Yeah, it's definitely that relationship building and talking about the things that are either propelling your work or causing you to have to pause consistently, and feeling that you can be honest about those challenges and know that you're going to get the support. I don't know if there'll ever be a time where the entire funding community has a shared understanding of the shared experiences of people in the communities we serve. And I don't know necessarily if we should use our time trying to get funders to understand that. What we should be doing is telling the stories and being very public about the experiences that are happening in communities, because that's what people pay attention to. That's what people respond to. That's what begins to ask the questions of, what's the root cause of that? Why is that happening? What can we do to help solution on that? And I think that's where you capture the attention of funders, are telling those really compelling stories around what you're seeing day in and day out, and then demanding the partnership that you need to be able to address them. And I agree completely with Caroline. We don't want to be extractive of the stories or feel like you have to put on the stage show, but the connection that we have to the people that you serve, you're that connecting linchpin. And if we don't hear it from you, then the likelihood of us hearing it in any of the other circles we participate in becomes slimmer and slimmer.
Right. And taking into account, of course, and I think we all are in agreement, taking into account all the protection and what we need to do. But I think it's interesting because there's two things, right? There's one that telling the stories and in a way that's honest and transparent, and then also telling the story about, look, it's hard for us to address these challenges. I think I said it this morning, but it's we can't pour from an empty cup, right? So what? And being really clear about that, this is the demand for psychosocial support has increased tenfold. we can't deal, like we're overwhelmed. And by the way, I think this is totally counterintuitive, and it goes against everything we ever want to do with funders. Like I can tell you as someone who's written tons of grants, and it's like you don't want to talk about the challenges because you feel like it'll affect you. But I think both of you are saying if you bring it, and I think all four of you have said this, like if it's a human, it's something very human, like it's relatable. So I think we need to be okay with that because everybody's been feeling that lately. So if there was ever a time to bring that up, it seems like it's now, and be more candid about it. What do you think, Elizabeth? What do you think, Craig? Do you guys have anything to add? Or?
Go ahead, Elizabeth.
I was going to say, I don't think, as someone who's not actually a funder, I think what both Caroline and Carla said really, really resonated. And I do think that in terms of this is the time to make those personal connections really resonates as well. So I guess I'd more say, yes, that resonates more than add anything to that part of the conversation.
Thanks, Elizabeth.
I think I would add just, first of all, in profound agreement with everything that's been said so far. Coming back to the question of trauma-informed care, and I'm not a clinician, so I'm a dad and a brother and a son of supporting people, but I think trauma-informed is it's a very important lens through which to approach this work, especially dealing with young people. Like any injury, physical or otherwise, the earlier you can start treating and understanding it, the better your outcomes are going to be, whether it's a social or a biological or a psychological injury. Particularly if you also include in the trauma-informed care this idea of post-traumatic growth.
Mm-hmm. Yeah, I wrote that down when you said it. I'm like, I'm going to have to start including that in the way, I talk about it, and I'm going to see what my colleagues think. We're closing in on the last 10 minutes, and there's so many really rich comments that you guys are making in this conversation. I think is really has been really really enlightening and really exciting. One of the other questions that someone asked, and I think going back to the measurement aspect, which I think that is tough. It's tough when we're talking about mental health and we're talking about outcomes. And somebody asked, are there better ways of measuring relationships in healing and trauma, or relationship building, right, in this space that can help organizations when they're trying to access funding? And again, I know that we had Craig and JJ, we have Caroline at Tinker, Carla at Kellogg, and Elizabeth at Bridgeband that kind of has a foot in both worlds. But I'm curious what you guys think. Like, it's not easy. It's one thing to have kids graduate nutrition. Like, how are we going to measure this and in a way that seems rigorous enough and without being extractive, right? Like, what do you guys think about that? I think that's a really important question to actually kind of close in on in the last few minutes we have.
I don't know if there's a clean way to measure, but we use a lot of proxies like the social determinants of health. What do you need that could help minimize some of the disruptions that communities experience? You need housing, job, food, security, those sort of things we look at to say what's happening within the communities that people reside, and are they able to access these easily? What's the rate of poverty? What's the access to healthcare? What's the school attendance and retention rates? We look at those proxy measures to talk about well-being in its holistic way. And I don't know if it's necessary to be able to have a measurement for mental health, because I'm not sure we'd ever be able to capture all of the nuances that exist within that space. What we can think about is what is it that we aspire for, in my case, children to be able to do and have, and how far are we away from that? And then what are the supports that we need to surround them by to get there? And less around solutioning on the symptoms, but more thinking about what are the root causes for why these things continue to happen and why they get exacerbated whenever there's a crisis. And then really trying to focus on those root causes, because I think it's a little easier to pick out some of the systemic barriers than it is to try to say for every child, what's that happiness metric? What's that healthy mental health space.
Yeah, it's super subjective.
Right.
So it's like we want to get here and we're here. What's keeping us here and what needs to be removed or addressed in order to get here?
Mm-hmm.
It's like logic, kind of like a logic model of sorts, but in a much more nuanced way. Thanks, Carla. What do anybody else want to?
I think I would just build on that to say that you can look, and again, we're a healthcare company, so these are the kinds of things we look for is how many people have access to whatever it is you're offering. Are you offering a quality evidence-based approach? And if it's not evidence-based yet, because frankly, in this space, a lot of it is new, are you collecting evidence to see whether it does in fact work and can be scaled out to other places? And then finally, the ultimate thing is, are you having the desired outcome that you're looking for?
Thank you, Craig. Caroline, Elizabeth, anything to add?
Yeah, no, I mean, we heard this morning, right, about, I think, about the 3 A's of access, affordability, and appropriateness. It does strike me that at least at the proxy level that we can move toward assessing how well we're doing on each of those dimensions. And then I would also just add, maybe echoing our experience with Glasswing and classroom-based work, that there's a lot that can be measured around the sort of the spread of certain behaviors and practices that are evidence-based, for example, around mindfulness or healing circles, like we talked about before, that we can't say with certainty A leads to B, but we know that having those be part of an educational community's sort of day-to-day is a good thing, right? And a worthwhile investment. And so that's maybe a little bit easier to track and have a handle on over time than more kind of clinical indicators, for example.
Thank you. Thanks, Caroline. Yeah. Anything to add, Elizabeth?
I think I would just I'd underscore. I agree with all the comments that my co-presenters have made, and I would also say that don't feel like you have to reinvent the wheel with respect to evidence-based, right? To the extent that there are robust studies that have been done on many of these indicators, like take advantage of that, right? You can likely draw connections between many pieces of this kind of work and the research that's already been done. So that can be a way to make it a little easier.
Yes, and by the way, everything all of you are saying from your mouths to the ears of so many people. I think not just funders, but also policymakers, right? And organizations. I think we err on the side of sometimes doing too much research when we should just look at what's there. And I think that's time consuming, it's expensive, it's tiring for teams. And then I think this has been awesome. I actually wish we had a lot more time. I think we need to get together more often to talk about this stuff. But I also want to end on one thing because it kind of brings together some of what we were talking about today. I want to first thank all of you because we're closing this out, but I want to say that we did a study. I think I have like 2 minutes. We did a study at one point, looking at character strengths, and we picked the ones evidence-based, right? Like what's important for kids to have: creativity, collaboration, all these like that we know like from the books, determination. And then simultaneously we had focus groups with the children and the kids we work with, and we came up with almost the same ones, but there was one that we were missing. And I've told some of you this before, but the one that we were missing from like these are the character strengths we're going to focus on developing or look at emphasizing more. And the one that we were missing that the students came up with and told us about was hope. And I think that says so much about everything we're talking about today. And I think it's tells us we have to listen, we have to ask, we have to be proximate, we have to ask again and listen again. And I think meet people where they're at and ask them what is the most helpful. So if we're more authentic in that work and committed to that, that's who we're accountable to, right? Yes, we have to report to funders, but our accountability should always stay firm. And I think we all feel accountable to the communities we work with, but we want to make sure that funders know that that's who we're accountable first and foremost. And then the funders are enabling us to do what we're best at. So I want to thank each of you and for your participation today, for your time. I think we're in the final minute, so we made it home stretch. Thank you. And I'll see you guys at the closing. And we thank you for your time and for everything you contributed to this important conversation.
Thank you for the opportunity.
Thank you.
Thank you.
Bye.